Hi, good afternoon. My name is Terika Thomas Mills, and today I'm going to be demonstrating intradermal injection. I'm going to start by verifying the physician's order, and then I'm going to verify the 6 rights of med administration. I'm going to verify I have the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. And I'm going to do any dosage calculation if necessary. So today the doctor has ordered 0.1 ml tuberculin skin test intradermal, and it is supplied in 5 tuberculin units per 0.1 ml. I'm gonna gather my supply. I'm gonna enter my patient's room, knock. I'm gonna close the door behind me for privacy, and I'm gonna perform my hand hygiene. Good afternoon, Mr. Mills. My name is Terry, and I'm gonna be your nurse today. Can you verify your full name and date of birth? Okay, so Mr. Mills has correctly identified himself using 2 identifiers: his name and his date of birth. Okay, Mr. Mills, do you have any allergies to any medication, any food, or maybe any environmental or seasonal allergies? No? Okay, so today the doctor has ordered a tuberculin skin test, and what this does, this just tests for the infection of the Mycobacterium tuberculosis. If you develop a skin reaction at the test site, this just tells us that you have a sensitivity to tuberculin, in which case you could just follow up for further evaluation, okay? So Mr. Mills, some of the side effects of this injection are going to be injection site pain, a localized rash or bruising. More concerning side effects, however, are going to be hives, shortness of breath, or you may experience swelling of the airways or face. But just let me know immediately if this happens, okay? And another thing, some people may complain of burning or stinging with the administration of this medication, so just be aware, okay? Do you have any questions? No? All right, so I'm going to perform my hand hygiene, and then I'm going to apply my clean gloves. All right, so the next thing that I'm going to do, I'm going to verify that I have the right syringe for this application. And what I have is a 1 millimeter tuberculin syringe with an attached 25 gauge 5/8 inch needle. And I'm also going to verify that I have my tuberculin vial. And then I'm going to clean the top of my vial using my alcohol prep pad. And then I am going to take my needle, and then I am going to withdraw 0.1 ml of air. And then I'm going to uncap my needle, and then I'm going to inject this 0.1 ml of air in my medication. All right, so now I need to withdraw my medication, which is supposed to be 0.1 ml. I'm gonna tap for any bubbles. Okay, so I'm going to recap my needle using the 1-hand scoop technique. And then let me just verify. I'm going to show it to the camera. that I have my 0.1 milliliter of medication. And if this was prepared elsewhere, I'd have to label my syringe with my medication and my dose. Okay, so the next thing that I'm going to do, I'm going to select my site for my PBD test. And for this site, I'm going to select the inner forearm, about 3 to 4 fingers width below the antecubical space, or 1 hand width above the wrist, or anywhere on the inner forearm. And then you could choose either site. If there's no acceptable site on the arm, then we could check the upper back. I'm gonna assess my skin for any lesion, any skin discoloration, any edema, any tenderness. And after I do that, I'm gonna clean the site with my alcohol prep pad. I'm gonna clean in a circular motion from inside out, and I'm gonna clean about 5 centimeters. I'm gonna allow this to air dry without fanning or blowing it, and then I'm gonna take my needle. I'm gonna uncap my needle, and for the site, I am gonna pull the site from the outer surface, from the I'm gonna pull on the skin around the site, making sure it's nice and tight. All right, so now I'm gonna go ahead and then I'm gonna inject my medication at 5 to 15 angle, and I'm only gonna go about 3 millimeters under the skin. And I should see a bulge when I do this. And I'm gonna inject the medication nice and slow. Okay, so when I do this, I should encounter a bit of resistance. If I'm not encountering any resistance, it means I'm too deep under the skin and I need to restart my procedure. I should also notice a little bulb about 6 to 10 millimeters as I inject, and I'm gonna place my gauze, and then if the needle has a safety mechanism, I'm gonna engage that, and then I'm gonna discard it in the sharps container. I could also apply a bandage if necessary. Okay, so I'm not gonna rub the site after I apply the gauze. I'm not gonna rub the site. And now I could go ahead and remove my gloves. I'm gonna discard all my supplies. And then I'm gonna perform hand hygiene and go document my procedure.